A very good morning to all of you. Today we will discuss an important topic that is important for both UG as well as for PG, that is mucopolysacchridosis. The question can be asked separately as a short note mucopolysacchridosis, or it can be combined with the LAQ, that is what are the mucopolysaccharides or glycosa aminoglycans, and what are the disorders that are associated with your mucopolysaccharides, or what are the mucopolysacchridosis. Okay, so let's start the topic. What is mucopolysaccharides? These are what? These are inborn error of metabolism. These are inborn error of what metabolism? Mucopolysaccharide. These are inborn error of your mucopolysaccharide metabolism due to lack of enzymes. Due to lack of enzymes associated with degradation of mucopolysaccharides. So what does it mean? That is, what is mucopolysaccharidosis? So what kind of disorder they are? They are inborn error of metabolism. So which metabolism? As the name suggests, mucopolysaccharidosis. That means these are related with your mucopolysaccharide metabolism. So these are the inborn error of mucopolysaccharide metabolism. Why these disorder occurs? These disorders occur due to lack of the enzymes, as there is lacking of the enzymes that are associated with the degradation of your mucopolysaccharides. Got it? So these are the inborn error of mucopolysaccharide metabolism which occur due to lack of the enzyme that is associated with the degradation of your mucopolysaccharides. As you know, if there is a lack of the enzyme, then what will happen ultimately in the body? If enzyme is not there, that means that these mucopolysaccharides will not degrade it, because the enzyme is not there. So if these mucopolysaccharides will not degrade it, then what will happen? Then they will start accumulating in the body. Okay, so when anything accumulated in the body in excess amount, then it's not good for the body. That means it will cause some disorder or disease. Okay, that's why when these mucopolysaccharides are not degraded by the enzymes in this disorder, so it will associate a variety of diseases. Okay, so what are the disorders or diseases that are associated with the mucopolysaccharidosis are? There are 7 types of mucopolysaccharidosis, but remember type 5 is not there. Okay, so the mucopolysaccharidosis type 1, type 2, type 3, type 4, but type 5 is not there. Always remember, type 5 is not there. Okay, then type 6 and your type 7. Okay, so what are these? That is your type 1, then your type 2, then your type 3, then type 4. 5 is not there, then after that 5 is not there, type 6, and after type 6 it is a type 7. Okay, so the mucopolysaccharides are divided type 1, type 2, type 3, type 4, type 5 is not there, type 6 and type 7. Okay. So what is type 1? Type 1 include 2. One is your severe form of this disorder and other is your mild form of disorder. Okay. So in type 1, one is a severe form of the disorder and one is the mild form of this disorder. So severe form of disorder is known as your Hurler disease. Okay. Hurler disease. And mild form is known as SCHIE. 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 So severe form of type 1 is Hurler and milder form of type 1 is your SCHIE. Type 2 is your Hunter. Type 2 your Hunter disease. Type 3 is your Sanfilippo. Sanfilippo disease. Okay, Sanfilippo. Type 4 is Morquio disease. And type 6 is Mortox-Lamy. And type 7 is your slide. Okay, so you have to remember the name of all this disorder. That is type 1 includes 2. Severe form is known as Hurler disease and milder form of type 1 is She. Type 2 is your Hunter disease. Type 3 is Sanfilippo. Type 4 is Morquio. Type 5 is not there. So type 6 is your Morteaux Lamy and type 7 is Sly. This Sanfilippo having a 4 forms of disease, A, B, C and D, and this Morquio is having 2 forms, that is A and B. Okay, so this is the classification of your mucopolysaccharidosis. Now let's understand what enzymes are lacking in this disorder. So the enzyme which is associated, now enzyme deficiency. What enzymes are deficient in which disorder? Okay, so in type 1 there is deficiency of enzyme L-iduronidase. L-iduronidase. When this enzyme L-iduronidase is lacking, then it will cause what kind of mucopolysaccharidosis? Type 1. Now remember, if this L-iduronidase is completely deficient, means if there is a complete deficiency of this enzyme, then it will result in the severe form of disorder, that is your Hurler. Okay, if it is completely absent. But if there is a partial deficiency of this L-iduronidase, then it will result in the milder form of disease, that is She. Okay, so this is the difference, why Hurler is severe form and why She is milder form, because in Hurler disease there is a complete deficiency of this enzyme. That means your body, the person who is suffering from this disorder doesn't have this completely deficient of this enzyme, while in She small amount of this enzyme is present and there is a partial deficiency, and because of partial deficiency it will result in the milder form of disorder. All right. Now comes on the Hunter. In Hunter, there is a deficiency of enzyme iduronate sulfatase. Iduronate sulfatase. Okay. When enzyme iduronate sulfatase is deficient, then it results in disorder, that is a Hunter. Okay. Iduronate sulfatase enzyme. Then Sanfilippo. In Sanfilippo, the enzyme which is deficient is that of heparin sulfatase. Heparin sulfatase. Okay, so when heparin sulfatase enzyme is not there, it results which disorder? That is your Sanfilippo. Now comes on the Morquio. In Morquio type A, the enzyme which is deficient is that of N-acetyl galactosamine. N-acetyl galactosamine 6-sulfatase. Okay, in type Morquio type A, the enzyme deficient is that of N-acetyl galactosamine 6-sulfatase, while in Morquio type B, the enzyme which is deficient is that of beta galactosidase. Okay, so when there is a deficiency of this enzyme N-acetyl galactosamine 6-sulfatase, it will result which disorder? Morquio type A. But when there is a complete deficiency of this enzyme beta galactosidase, then it results in disorder Morquio type B. B is beta. Okay, you can remember. Now type 6. Type 6 is due to deficiency of enzyme N-acetyl galactosamine 4-sulfatase. Now, this enzyme, that is N-acetyl galactosamine sulfatase, is the same. But remember, in type 4, there is a 6-sulfatase. And type 6, there is a 4-sulfatase. That means opposite. In 4, there is a deficiency of 6-sulfatase. But in 6, there is a deficiency of your 4-sulfatase. Otherwise, enzyme is similar. N-acetyl galactosamine sulfatase. So, if 6-sulfatase is lacking, then it will result in your type A Morquio disorder. But if N-acetyl galactosamine 4-sulfatase enzyme is lacking, then it will result in your type 6 disorder, that is your Morteaux Lamy. Okay. Now comes on the Sly. In Sly, there is a deficiency of enzyme beta glucuronidase. Beta glucuronidase. Okay, so these are the enzymes which are lacking in this disorder. Okay, so in type 1, when there is a complete deficiency of this enzyme L-iduronidase, it will result in disorder Hurler, and it is a severe form of disorder. When this L-iduronidase enzyme is partially deficient, then it will result in the milder form of disorder, and that is known as your SHE. Now type 2. In type 2, the enzyme iduronate sulfatase. So iduronate sulfatase enzyme is lacking. It results in disorder Hunter. That is your type 2. Okay. When enzyme heparin sulfatase is lacking, then it results in disorder type 3. And what is type 3? That is your Sanfilippo. Either A, B, C or D. Detailed study hasn't been discovered on this A, B, C, D. So you can remember that Sanfilippo is 4 types, A, B, C, D, and enzyme heparin sulfatase is lacking in this disorder. Okay. Now comes on your type 4. In type 4, Morque's type 4, it is A and B, categorized into A and B. In Morque type A, there is a deficiency of this enzyme, N-acetyl galactosamine 6-sulfatase. Remember, 4 is having deficiency is 6. Okay. In 4, there is a deficiency of 6, and in 6, there is a deficiency of your 4. So in type A Morque, N-acetyl galactosamine 6-sulfatase is lacking. In Morque type B, B is like beta, so beta galactosidase is lacking in this disorder. Type 6 is your Mortex clami and deficiency of enzyme and acetyl galactosamine, as it is 6, so there is deficiency of 4-sulfatase. And in slide, beta glucuronidase is not there. Okay. Now comes on the what could accumulated in body. Accumulation. If these enzymes are lacking, then what is accumulated in body? So accumulation. If enzyme is not there, then what will accumulate it? So remember, in all these disorders, heparin sulfatase and your dermatan sulfate. Heparin sulfate and dermatan sulfate is accumulated in all. Okay. Heparin sulfate and your dermatan sulfate. The question is asked as a MCQ 2 times in previous exam for this Hurler and Hunter also, that if there is a lacking of enzyme, then what get accumulated in the body? The option was there, heparin sulfate, dermatan sulfate, both keratin sulfate. Okay. So remember, in all the mucopolysacchridosis, there is a accumulation of your both heparin sulfate and dermatan sulfate, except of this your Morque. In Morque, there is a accumulation of your keratin sulfate. Got it? So in all mucopolysacchridosis, when enzymes are lacking, there is a excessive accumulation of your heparin sulfate and dermatan sulfate, except your Morque, where there is a accumulation of your keratin sulfate. Alright. Now comes on the clinical feature. As all these mucopolysacchridosis share almost same clinical feature, as all of these patient present with the same kind of clinical presentation. Few differences are there that I will tell you. Okay, how you will differentiate and how you will make a diagnosis. Okay, so what are the clinical features of the mucopolysacchridosis? So first is your hepatosplenomegaly. Why hepatosplenomegaly is there? As enzymes are lacking, so mucopolysaccharides will not be degraded in the body, and undegraded mucopolysaccharides get accumulated in your liver and spleen, and because of that accumulation, your liver is enlarged, your spleen is enlarged, and ultimately results in your hepatosplenomegaly. Okay. Second is that of your mental retardation. Patient present with the mental retardation. Same reason is that excessive accumulated mucopolysaccharides get accumulated in nervous system and started damaging your neurons, so patient present with the mental retardation. Third is that of your coarse facial features. Coarse facial features are there. Okay. Fourth is that of your corneal clouding. Corneal. Remember, corneal clouding is present in all mucopolysacchridosis except your Hunter. I already shared a mnemonic of this also on my channel. How you will remember that again I am telling you why that how you will remember that corneal clouding is not present in hunter, because suppose when hunter is going for the hunting of animal, then hunter should have a very good vision. Okay, so if hunter having a corneal clouding, then there is a blurring of vision and he is not able to do the proper hunting, and he is not able to do see the far distance animal. So remember, hunter should have a what? Hunter should have a very good vision for the hunting. That's why corneal clouding is absent in your hunter. This is the mnemonic and trick. By this you can easily remember. So corneal clouding is present in all kind of mucopolysaccharidosis except only hunter, as many times in the MCQ. Okay. Next is that of your skeletal deformity. Skeletal deformity. Skeletal deformity is present in all, like the patient is a short stature, easily fractured bone is there, easily fractured bone, etc. So skeletal deformity is there. So these are the clinical features of your mucopolysaccharidosis, that is of hepatosplenomegaly, mental retardation, coarse facial feature, corneal clouding in all except that of hunter, and skeletal deformity is there. Alright, and one thing you also remember in this, that is the inheritance pattern. What is the inheritance pattern in case of your mucopolysaccharidosis? So what is inheritance? Remember, all mucopolysaccharidosis are your what? Autosomal recessive. All are autosomal recessive. So inheritance is that of your autosomal recessive except hunter. Hunter is your X-linked disorder. Okay. It also has a mnemonic that hunter, if one goes for the hunting, then hunter is using the axe with it. Hunter is using the axe, carrying the axe for the hunting animals. So from the axe you can remember hunter is the only disorder which is X-linked. Otherwise all mucopolysaccharidosis are autosomal recessive. Okay, so this is all about your, yesterday I already shared the video of mucopolysaccharides, so you must watch that video. So the question is asked separately on this topic as a short note, otherwise combined. So you must read this topic mucopolysaccharides as well as your mucopolysaccharidosis. If you have just read this is a complete information regarding to your mucopolysaccharidosis. Okay, so this is all about today. Thank you.